This is a short video to explain Travelers Aid's approach to workforce mental well-being. Did you know that in addition to physical health and safety measures, Travelers Aid recognises psychological injury as a health and safety issue?
But what sort of psychological injury do we face at Traveller's Aid?
Well, if you think about it, on an operational level, we provide services at public spaces such as transport hubs and events. Our staff and volunteers attend to service users from different backgrounds and unique situations. In some cases, service users may be anxious, agitated, or under the influence of drugs and alcohol. This has the potential to expose our workforce to volatile or unpredictable scenarios. During times of crisis or in emergency situations, services at one or more of the sites can also be significantly impacted. How this in turn affects our people and our workloads must also be monitored. On an environmental level, our staff and volunteers may need to perform their duties at night or in extreme weather conditions. Some programs require members of the workforce to work at public events, including crowded areas. Whereas on an individual level, personal circumstances and existing mental health conditions may affect how individual members of the workforce deal with workplace stresses.
I wonder what our colleagues think.
We get to encounter so many positive and beautiful moments in our work, but we also face our fair share of challenging, stressful, and emotionally impactful situations.
I'm a mother of two, I work, I've suffered postnatal depression in the past. I also have anxiety and depression. This can be challenging for my day-to-day things, including managing my family and coming to work. I am very open about it. I think being open about it encourages other people to be open about it and riddles that stigma that is attached to it.
We do deal with people with mental health issues. They often come in asking for assistance for tickets, showers, food and accommodation.
I can relate to one incident by which some of our employees, including myself, were really traumatized. I personally witnessed a major incident happen in the heart of Melbourne City in 2018.
Whenever I've needed to submit an incident report, I've so quickly had someone from management on the phone calling to check in, making sure that I'm okay, listening and showing empathy for what I've been through, as well as providing really practical strategies to move forward, whether it be referrals to counselling, further training is always on offer, as well as problem solving to reduce the risk of mentally stressful events occurring again.
How I've managed to deal with this is doing the mental health first aid training. I also find it very helpful debriefing with my colleagues and my managers.
Having that compassion within an organisation like Travelers Aid really does assist not only us but the general public to feel safe, welcome, and that we do try our best to understand. It can be quite confronting at times when it's people that we've never met before and they can come in quite aggressive, but that's what we've got the training for, and that's exactly what we have each other for as well.
My managers were really supportive and kept me in their thoughts and care, and that helped me to recover easily and in no time.
Something I really appreciate about working for Travelers Aid is their commitment to ensuring a positive mental health culture for the workforce.
We at Travelers Aid have established a mental health strategy. The purpose of this document is to provide a structure and framework for the Travelers Aid Mental Health and Wellbeing Program. So, what does this all mean? In the upcoming months, you will see us increase promotional events to raise awareness of mental wellbeing. We will improve external partnerships with experts in the field. We will work to review our current programs and documents, such as our Employee Assistance Program, Reward and Recognition Framework, and our position descriptions to ensure that these responsibilities are covered and understood by everyone. We will encourage regular conversations around mental well-being. We will encourage regular mental health training for all staff and volunteers. We will seek to identify members of the workforce who will promote health and well-being to improve communication across multiple sites and programs. And we will increase awareness of support resources available to you within and outside the organisation.